So the symptoms of myelofibrosis, as well as the side effects of certain medications, can vary greatly among patients. Why is it critical for patients to share any issues they may be having with their care team?
Yeah, exactly what you said. So those two concepts are tied because the disease is so rare and it's so heterogeneous, not just patient to patient, but within the same patient over the journey of years. That is the reason. So because of that, that's why one has to communicate every single thing to the healthcare team. It's interesting. Something that the patient may not believe is serious, the caregiver sometimes knows, right? Right, team. So sometimes the person who's your loved one or caregiver, that's not quite right. Sometimes the patient knows, obviously. And then sometimes the healthcare team may say, that's not quite right. I think the not quite right thing is the key because that is what supersedes or at least precedes lab testing, x-rays, imaging, bone marrows. There has to be some provocation. And so what I try to tell people is you know your body best. So you want to be in touch with yourself, with your body, and anything that isn't right, don't be the final judge on that. Push it up the chain. Let your caregiver know, let your doctors know, let your team know, and let them help you decide. Sometimes it may be nothing. That's fine. Sometimes it may be something. Sometimes it may be something outside of your MPN. That's another key theme I think I've mentioned here a couple of times. Anemia is a good example. So lowering of the hemoglobin. In addition to, it's exactly what you just asked me. So in addition to looking to see if it's the disease progression itself, okay, fine. But could it also be drug toxicity, as you mentioned? So the JAK inhibitor may be causing the anemia or whatever. And then the third bucket is, could it be anemia of regular life stuff, iron deficiency anemia? Could it be a colon cancer or a polyp that's hiding there? Could it be vitamin B12 deficiency, hemolysis, immune, something destroying the red blood cells, et cetera, et cetera? So you make an awesome point, which is all of that can be alleviated or the ball can be started rolling, if you will, by mentioning it. So the key is no shame, no silence, mention everything.
No silly questions.
No silly questions. That's right.
Right.